Obesity is certainly multifactorial. There is no one cause that we can identify. Generally, though, it's considered among sort of serious scientists, physiologists, serious public health professionals, physicians in this field, that it represents an imbalance of energy, so an energy imbalance of the energy that is taken in, so the intake of energy, and the energy that is expended. So it represents either too much intake and not enough expenditure, or I should say too much intake or insufficient expenditure, or a combination of the two. And there are many pathways that may lead you to consume too much or not to exercise or engage in enough physical activity. This has been a problem that epidemiologists have been confronted with and are well aware of, this link between low-calorie sweeteners, no-calorie sweeteners that provide no calories, and obesity and its downstream complications such as diabetes and cardiovascular disease. Again, among serious epidemiologists in the field and public health professionals, this is generally considered this relationship to be considered to be at high risk of reverse causality. This is a case where it may not be the low-calorie sweeteners that are driving or causing the obesity and its downstream complications, but rather that it's people that are overweight or obese or at risk of overweight or obesity and these other cardiometabolic diseases. It's having that predisposition that actually drives or causes a greater intake of low-calorie sweeteners. So what you get is a reverse causation phenomena or scenario. So it's likely that seems to be the case, and I think there's good evidence that probably is the case, because there's incongruency or disagreement with the randomized controlled trial evidence that give us protection against that bias. That evidence shows quite clearly that low-calorie sweeteners are of benefit for weight loss. So I think low-calorie sweeteners are one strategy. There are many ways which we can alter this energy balance, if you like, the intake and the expenditure. Low-calorie sweeteners represent a way of satisfying one's desire for a sweet taste while limiting calories. So it has the potential to replace excess calories in the diet, for example, from sugar-sweetened beverages or other sugar-sweetened products. So it represents, I think, a very meaningful pathway for many people to reduce calories, but it may not be for everyone. So it's just one of many pathways. For many people, it may just be using water to replace sugar-sweetened beverages or portion control. So it shouldn't be, I think, regarded as the solution, but I think it's just one more tool in the toolbox that physicians and dietitians can use and discuss with their patients. So this has been an ongoing question in the field of whether sweetness is somehow related to the development of overweight and obesity. There's this concern that the uncoupling, in particular relates to sweeteners, of the sweet taste and energy may have downstream effects that will actually lead to greater intake of calories, in particular from sugary foods, that it will engender or stimulate a desire for sweet foods and maintain that desire and wanting for sweet foods. There's also a concern that it may lead to metabolic dysregulation, and that it tricks the body into thinking, again, it's had calories when it's not, and lead to a series of metabolic and endocrine responses that lead to dysregulation of food intake. Well, the evidence on that is from randomized controlled trials has really been quite clear that there isn't this link. And in fact, when we look at the evidence from randomized controlled trials as it relates to low-calorie sweeteners, we actually see that they are associated with decreased energy intake, decreased intake of sugary foods, and they actually assist in weight loss. So given the evidence from such a high quality design in the randomized controlled trial that protects against bias, I think this really puts to rest a lot of these concerns. But I think we need more trials of patient important and public important health outcomes with low calorie sweeteners to really understand their impact and influence in different groups. So I think more research is needed. It's not to say that we have all the answers, but I think the answers we have at this point give us confidence that that's not the case.